As my physician friends at She Found Motherhood would say, the best way to sleep once you get home from a hospital is the position that allows you to sleep. There is no contraindication to sleeping on your back or on your side or on your stomach or whatever. Obviously, if it's uncomfortable or if it hurts, avoid it. But basically, sleep is best and rest is how you recover. Answer to second part of this question, how to get up after a cesarean. Well, the closer you are in a upright sitting position, the easier it is to get out of the bed or the chair or the toilet. So, for example, if we're talking about getting out of bed, sleep in a reclined position, almost like making a ramp made out of your pillows. There are actual ramps that you can also buy and put in your bed. And this is why when you're in the hospital, those electronic beds that can adjust to get you into a seated position is so helpful, because they do help you get out of bed when you don't have the full use of your abdominal musculature. Traditional belly binding like Bangkang wraps are persisting after hundreds of years because they're helpful. Now, here's the thing. You want to make sure that whatever abdominal wrap you choose, it is not too tight. If something is too tight, it can actually cause more pain and more injury. The way you would know is if you have a lot of pelvic floor pressure after the belly binder is on. Another one is if the belly binder actually causes more pain in the abdominal region within minutes of putting it on. So that's how you know if it's too tight. Otherwise, abdominal compression helps with pain management, helps with swelling, and also helps a lot with feeling supported and protected as you go about moving in your day, because your abdominals have been injured. This bent over or curled up posture after pregnancy is actually quite common, but it does not have to be your new normal. Here's what all of my students and my mamas do when they work with me. They start with something called the ABCs, and that stands for alignment, breathing, and core control. Now, regardless of if you're day 1 postpartum, month 1, year 10 postpartum, everyone can benefit from the ABCs if you've never done a foundational core retraining program. So I'm going to link the ABCs program down below. You can read up more about it. It is absolutely the essentials of where you would start before you return to exercise. This type of pain after a cesarean birth is actually quite common, and if I'm reading this correctly, what this mom is describing is midline abdominal pain between the scar and the belly button. So what she may be experiencing is extra load on that linea alba, or that diastasis, where that vertical incision was made. Don't forget, during your cesarean birth, there are actually 3 incisions made. External, usually horizontal incision. Second is that vertical incision right down the middle, and then the third on that uterus. So it's that vertical incision that you don't see that you may actually be getting a lot of pain in. So causes of this pain can be adhesion. So if you haven't started scar massage, please start that, but absolutely pair that with progressive core control exercises. Send me a DM or message me here below if you have more questions. There are a few reasons why there may be pain on one side of your stomach after your cesarean. Firstly, if you're in the first 6 weeks post-cesarean, please connect with your doctor right away if you have any mysterious pain. You have to make sure that this is not caused by an infection. Now, if there's no infection, one-sided pain is actually quite common. It could be caused by extra tension on one side of your scar, imbalances in the development of your core depending on how many months are out, tension in one hip flexor that doesn't exist in the other, tension in your lats, which is part of your thoracolumbar fascia, and that's connected with the front of your body as your external obliques. There's a lot of stuff going on. So it's hard to answer this question just based on no information in terms of the background and history. So if you have specific questions about your cesarean, send me a message here below. Here's a fact about how the human body works. Scar tissue is created in response to the loads that you place on your body. So that's just a fancy way of saying if you push and pull and challenge the healing incision, your body's gonna say, oh shoot, that's gonna split open, gotta close that down, so it lays down more scar tissue. Now, don't let that be a red flag and say, oh, Jeanette told me not to move, because then it'll just get all messy in there. That's not actually true. So what you want to understand is that after any kind of surgery, any kind of injury, movement is medicine, but you want to be slow and progressive and planned about it. So that is how you're going to ensure that the scar tissue that gets laid down is going to be the amount that is needed. In general, you can do scar massage while pregnant, but the big question that I would have is why would you want to do your scar massage? Are you in pain? Does the scar feel tight? Are you sure it's the scar? So with these questions in mind, what I would strongly suggest is for you to see a perinatal therapist in person to do an assessment, just to make sure that it is in fact your scar that is creating pain and tension. Because during pregnancy, there's a lot of stuff that could be going on and a lot of different feelings, and you just want to make sure that the treatment you decide to follow is going to be one that works for you.